Well, thank you all. Thank you all for being back here in the conference room, for respecting the program and also the bell ring. We are ready to restart our conference. Our next session is meant to set a scene on occupational safety and health in Europe at this very moment. Since before the lunch, we had just before the lunch, we had this Good Practice Award ceremony on healthy workplaces manage stress. I think it's quite fits into place that in introducing our speakers, I'll share with you some knowledge on how they personally deal with stress. It is my great pleasure to introduce our first speaker of this session that is very well known to most of you. Ms. Maria-Teresa Moitinho de Almeida, who is the head of Health and Safety and Hygiene at Work unit in the European Commission. We all know her as a hard worker at the European Commission. But what we maybe don't know is how she really copes with the hard and tiring working days. So for this, Maria-Teresa likes to spend her time with her family and loved ones. And what a family she has, being a mother of 4 children. So for some private moments, she likes to take a longer walk with the dog outside, being along with the dog, and maybe sinking into some very good literature. With this, the topic Ms. Moitinho is about to present us today is the EU Strategic Framework in Action. Ms. Moitinho, please, the floor is yours.
Thank you very much for these kind words. And first of all, good afternoon, ladies and gentlemen. It is my great pleasure to participate in this Latvian President's Conference in this so beautiful town, Riga. It is my first time visiting the town, but certainly not the last. I am particularly pleased to participate in these sections that aims to set the scene on occupational safety and health in Europe. Let me first repeat, like my director, Mr. Jordi Curral, has already said, this conference is more than timely, almost 1 year since the Commission adopted the strategic framework. Feedback was already received from European Union institutions and also from the stakeholders, and therefore it is really timely to present to you with the state of play of the implementation of the strategic framework. And this is what I will intend to do during my presentation. First of all, only to give the background that we all well known. European Union has been active since decades in the field, and the development of the European Union policy on health and safety at work is based on 2 key components: a comprehensive legal framework that ensures a high level of protection of the workers' health and safety against any risk resulting from work, allowing member states to set more strict standards. This legislative framework is undergoing a process of evaluation according to Article 17A of the Framework Directive 89391, the pillar of the whole occupational safety and health legal acquis. Second key component is the multi-annual action programs that were followed by strategies, and they aim at ensuring coordination of policies at EU level around common challenge and objectives. So the European Union policy in this area is based on the premise that job quality and health and safety working environment can highly contribute to competitiveness and growth. In line with this principle, the strategic framework points to occupational safety and health as a key factor to improve economic performance as well as working and living conditions. Keeping workers healthy has a direct and measurable positive impact on productivity. And we all know, several studies proving this. Last but not least, good quality occupational safety and health policies can significantly contribute to improve sustainability of social security systems by, among others, addressing the long-term effects of demographic aging. So we all know how the strategic framework is structured. There are identification of the main challenge for the concerned period, with certainly the need to improve implementation of occupational safety and health legislation, in particular by micro and small enterprises, the first main challenge, followed by the need to promote and improve the prevention of work-related diseases by anticipating and improve the prevention of these diseases. And finally, the third challenge relates to the demographic change and to the need to tackle this change by ensuring sound health and safety for a sustainable working life and active and healthy aging. Against this background, the strategic framework identifies 7 key objectives and a number of related actions, and also identifies main instruments to address these key strategic objectives and challenge. So let's now focus on where we are on the implementation of the strategic framework. And first of all, we have to say that the involvement of all is crucial to ensure a proper and effective implementation of the strategic framework. Indeed, and it is mentioned in the strategic framework that it is a framework for action, cooperation, and exchange of good practices, and this implies certainly an open debate and collaboration with the other European Union institutions and also with the key stakeholders. And we know that the European Union institutions and the key stakeholders are already providing feedback to the Commission on the strategic framework, and they are also putting forward suggestions for the successful implementation of the strategic framework. So first of all, I need to refer to the fact that multi-annual programs of the European Agency for Safety and Health at Work, as well as the multi-annual programs of the consultative bodies of the Commission are adapted or are being aligned with the key challenges of the strategic framework. In the case of the European Agency, it's aligned, and in the case of the Advisory Committee, the multi-annual program would be adopted next month during the plenary meeting of May. The Senior Labour Inspectorate has its multi-annual program aligned with the main challenges, but in any case, next year it will start to work towards the whole period until 2022, align all the different actions in light of the main challenges of the strategic framework. So, regarding the, So regarding the state of play of implementation, we have also received the feedback from the European Union institutions, as I mentioned. And first of all, allow me to refer to the feedback that we received from Council. So Council has been dealt with the different challenges of the strategic framework since the adoption by the Commission, and by organizing the different presidencies have organized some debates during EPSCO meetings lunch, and for instance the Greek presidency organized a debate on psychosocial risks during the Greek presidency, and there was also a lunch debate organized by the Italian presidency on aging workforce in December 2014. Also, the presidency's conferences aimed to debate the main challenges and key strategic objectives of the strategic framework. And finally, I have to mention, and it was already mentioned by the Minister here, the Council conclusions adopted on 9 March on the strategic framework. So, if you allow me to detail a little bit the conclusions adopted by Council on 9 March, and it is first of all interesting to notice that the Council acknowledged the same main challenge for the concerned period as the Commission in its strategic framework. But the Council considers that there should be a sort of prioritization in the actions to be carried out during the period, and the Council starts with the practical implementation of occupational safety and health legislation in micro and small enterprises, followed by the need to tackle new and emergent risks, including psychosocial risks and those linked to new technologies and material. The Council then in this prioritization indicates that the prevention of occupational diseases, in particular cancers and musculoskeletal disorders, are of utmost importance, followed by the challenges of an aging workforce, or, for instance, the mainstreaming of occupational safety and health in other relevant policy areas. So after made this prioritization of actions, the Council proceeds with the calls to Member States, to the Commission and to social partners. First of all, to the Member States, and certainly the first call on Member States is to review or adapt or adopt new occupational safety and health strategies in light of the European Union strategic framework. But there are all other interesting and important calls on Member States linked to the need to improve enforcement by providing appropriate resources to labour inspectorates, or to provide certainly supporting tools to enterprises, or to use European Union funds to promote occupational safety and health. Then the Council calls on the Commission, and the first call to the Commission is, Commission, you shall continue to promote occupational safety and health in European Union, but you have at the same time to simplify occupational safety and health legislation, but without reducing the existing level of protection. Taking into account certainly the results of the ex-post evaluation, and in line with the objectives of REFIT, and taking into account the change in the workplace resulting from technical, logical developments. So the Council still calls on the Commission to improve legislation on carcinogens or to ensure consistency between REACH and occupational safety and health legislation, or to improve the data collection with a view to ensure that new initiatives are based on the best available evidence. And certainly there are other calls linked to the need to give support to workers and to employers to developing certain supporting tools. Finally, the calls on the social partners. The Council asks the social partners to engage actively in the development of national strategies to promote prevention culture among their members, to disseminate good information on OSH, to provide also support to their members, to employers and workers, with a view to promote the necessary knowledge and skills. Other European Union institutions have also give feedback on the strategic framework, starting with the European Economic and Social Committee through its opinion adopted on 11 December. I'm not going to enter into detail of these opinions, only to highlight that the European Committee appreciates the Commission intention to focus on prevention, on rules of simplification without jeopardizing existing protection levels and proper compliance with rules. So the committee pleads for a balance between a high level of protection and administrative burdens. It welcomes the Commission focus on small and micro enterprises, providing them with the adequate supporting tools. It recognizes the need for more investments on health and safety by enterprises and by member states, and it considers that it is essential the involvement of all in the implementation of the strategic framework, but I will leave then to the representative of the European Economic and Social Committee to detail this, certainly this opinion. It is also relevant to note that the Committee of Regions also provide feedback to the Commission, to the strategic framework, adopting its opinion on 12 February, and in this opinion it acknowledged the importance of European Union level coordination of occupational safety and health measures, and put forward some suggestions in relation to this. It emphasized the role of the local and regional authorities, and in particular the role that they can play in promoting health and safety at work. It calls to strengthen social dialogue. It questions a lack of certain provisions for specific legislative aspects. The European Parliament is currently working on its feedback to the strategic framework, and of course the European Commission, but also the European Agency for Safety and Health at Work are carrying out different activities addressing the three main challenges. If I can structure a little bit the ongoing activities and initiatives. So regarding the first challenge, better implementation of OSH legislation, in particular from micro and small enterprises, the Commission adopts and has already adopted certain non-binding guides recently on nanomaterials. It is about to publish also a non-binding guide on mental health that will help the employers to apply effectively the legislation legislation. European agency is developing the well-known IT tool to support employers to make their risk assessment, OIRA, and of course is developing other actions that will contribute to support and facilitate access to good practices from employers. The Commission is also about to sign an external contract with a view to develop instruments for labour inspectorates to facilitate their inspection role as regards micro and small enterprises. We have also actions in the field of subcontracting, because to see how we can promote occupational health and safety in the different chain of subcontracting. So there are indeed a number of actions and activities that are ongoing. Regarding the second main challenge, prevention of work-related diseases, of course, first of all, the ongoing European campaign carried out by European Agency on psychosocial risks, because this is a major raising awareness initiative that will promote the prevention of work-related diseases in this area, but also the development of an external studies on exposures, creating a database on exposure to chemical substances that the Commission is currently developing, or the initiatives that we are also developing together with Eurostat on the development of European statistics on occupational safety and health. And finally, regarding the third challenge, initiatives are ongoing regarding the demographic change, in particular the pilot project that is being carried out by Bilbao Agency on behalf of the European Commission, but also an important number of activities that are being carried out by DG Employment and DG Public Health Director General. Finally, only to say that the strategic framework will be reviewed in 2016 in light of the results of the strategic framework and of the views received from the European Union institutions and the other stakeholders. Thank you very much for your attention.
Well, thank you very much indeed, Ms. Moitinho, for this introductory session, and also presenting us a state of play of EU strategic framework. Our next topic logically follows the previous one, and it is state of play of the ex-post evaluation of OSH acquis. I believe many of us here in the room have taken a direct, let's say, part in this exercise, and I think we are all very keen to learn how far we have gotten and what we are really to expect. This will be explained to us by Mr. Jesús Francisco Alvarez Hidalgo, who is the deputy head of the same unit as Ms. Moitinho. Jesús, on his part, is quite active in sports. Best of all, he is preferring some bike rides in forest, and being in nature, out of urban areas, really helps him to cope with hard work he's doing in office. Jesús, please, the floor is yours. Por favor.
Thank you, Renard. Good afternoon, everybody. Thank you again for the Presidency for letting us sharing this information about the ex-post evaluation and for the excellent organization of this conference. As you mentioned, I will have the pleasure to share with you information on this challenging exercise of the ex-post evaluation. And that is not new for some of you. A lot of you, I would say, have been involved very actively in this process. And maybe I will start by emphasizing that this is a really challenging and new exercise, This is probably the most ambitious ever evaluation carried out by the Commission in a given policy area, and of course the first time in the policy field on health and safety at work. This is new as well in the context of the Framework Directive. This is part of a new exercise to be carried out every 5 years. For this first time, exceptionally, it covers 6 years, from 2007 to 2012, including both years. And what this exercise is intended is to evaluate 24 directives on OSH according to specific criteria, in particular according to the criteria of relevance, effectiveness, and coherence. And what do we mean by that? By relevance in particular. Relevance is to examine the extent to which the aims of the directive, of these directives, 24 directives, are still up to date now in addressing needs, in addressing the relevant OSH issues, including not only the current relevance today, but as well the future relevance, taking into account the known trends in the field of health and safety at work. Effectiveness, of course, is essential to know, to analyze if the directives are achieving what they are supposed to achieve, and in particular, how significant these achievements are. And another important aspect, the benefits and the cost. How is the distribution of the benefits and costs that can be attributed to these achievements by the directive? And third, and very important, the coherence. Assess, if any, possible inconsistencies, overlaps, and/or synergies internally across and between the directives themselves, and as well externally with other pieces of legislation in the social policy area, addressing as well OSH issues. A good example, as you know very well, is REACH. REACH is mainly in the environmental scope, but there are some very substantial aspects of workers exposed to chemical agents. So it's a very good opportunity to assess as well the internal and external coherence of the legislative regulatory framework. Of course, the Commission, on the basis of this challenging exercise, will produce a final evaluation that will be transmitted to the other institutions, in particular to the Parliament, to the Council, to the European Economic and Social Committee, the Advisory Committee, of course, putting the focus on how to improve the functioning of the regulatory framework. In this context of trying to explain what the exercise it is, maybe it is important to emphasize the fact that this is, of course, under the so-called REFIT, the Regulatory Fitness and Performance Program, which aims at ensuring that the regulatory framework at EU level is relevant, is coherent, is effective, and is efficient, and that, in general, the EU legislation still remains fit for purpose. So that are the, let's say, classical elements of a so-called fitness check. I like this expression of fitness check, which includes as well other classical element, is the evaluation of administrative burden, in particular the unnecessary administrative burden. But it is important to mention, in our opinion, that this exercise of evaluation of the directives goes beyond the REFIT exercise. Why? Because it is as well conducted in order to fulfill a specific legislative mandate, a mandate on the Article 17 of the Framework Directive, mandating or asking the Commission to evaluate the implementation of the 24 EU OSH directives in terms of relevance, but as well of research and of new scientific knowledge. And that's essential. As you know very well, in this policy field, the technical and the scientific developments are very quick. And that's as well a good opportunity to look to the directives in this perspective, in the perspective of how the technological and scientific developments are impacting in the field. And another important feature of this exercise is the particular attention to small and medium-sized companies. That's obviously a clear and essential element in this exercise. I will as well emphasize one aspect, and is that this evaluation arrives in a moment in which there is a new culture of evaluation in the Commission. And this new culture represents an evolution, because now the evaluations carried out by the Commission didn't focus only on the, let's say, legalistic technical aspect on how the legislation is being formally transposed and implemented in member states, but in this new culture, that the evaluation is looking as well in the economic and social impact, how this implementation is effectively impacting in practical terms in member states. And another aspect of this new culture of evaluation is that instead of analyzing separate pieces of legislation, the evaluations are covering a whole legislative area. In our case, obviously, health and safety at work. So these two elements, in our view, are particularly relevant to understand the spirit and, let's say, the philosophy in which the evaluation is being carried out. There are 24 directives being evaluated. As you will see in the list, we can see different groups of directives. The general ones, the framework directive also, of course, is the main significant, but other general directives, work equipment or personal protective equipment, for instance. There are, as you see in the list, other directives more focused on hazard-specific aspects. A good example is the chemicals one, carcinogens and mutagens, asbestos, biological agents. So these directives are focused on specific hazards. Other ones are more considering or focused on sectors. Is the case of the mining directives, drilling and so on. Is the case of the fishing vessels or the medical treatment on board vessels. There is still a long list addressing specific hazards, the whole package of the physical agents, noise, vibration, electromagnetic fields, optical radiation, of course. And there is also a group addressed to specific types of workers. Is the case of the pregnant workers directive, for instance, or the young workers, or the temporary workers. So you see that there are a very curious mix. The legislative corpus is composed by different approaches in the directives, which is an additional element making it maybe more challenging. In trying to understand the main elements of this ex-post evaluation, and in particular of the final product that the Commission will produce, it's important, in our view, to mention that national implementation reports are of a critical importance, of course. Member states were requested to provide to the Commission to send the national implementation reports according to a structure and a specific questionnaire that was developed by the Commission with the support, of course, of the advisory committee, of the tripartite advisory committee, including the views of social partners, indeed. And these national reports cover two essential elements. One is, let's say, general, a general part covering all the directives, how they are being implemented in member states, and a specific part regarding specific questions which were addressed relating each one of the directives. So there are the two elements of the national implementation reports. The evaluation itself will be based in an external study, which is being carried out by an external contractor. As most of you know, is being led by COBI with Milieu and IOM. This group was selected among 5 tenderers in a quite complex process of selection after the tendering. And there is another element that, in our view, will somehow enrich the process of evaluation, and is the Commission, the experience that the Commission has now in with the directives. For instance, a lot of experience have been gathered when analyzing the implementation of not only the implementation, but the conformity first, the process of analysis of conformity of the national pieces of legislation transposing the EU directives, the analysis of complaints, the infringements procedures in some cases. So this overall extensive experience of the Commission will be as well be contributing to this exercise. So in this context, there are 3 main tasks being carried out in this evaluation process. One, obviously, is mapping the practical implementation at national level in all member states. And in this mapping, there are 2 key elements. One is the providing an overview of the national framework in which exists to put the directives into practice at national level. But this is only one part, the national framework. Another essential part to which the evaluation is looking at as well is how companies and public sector as well, public bodies, are putting these national frameworks into practice on the ground at practical level. So this is covering the whole spectrum of the reality, frameworks on one hand, and on the other hand, the practicalities about how it is being implemented. The second task is the evaluation against the criteria I mentioned before: relevance, effectiveness, and coherence. The whole extensive and detailed evaluation responding to the questions to these 3 criteria. And the third task, and probably one of the most challenging into practical view, into the practical results, is the recommendations. And the recommendations intended to improve the regulation of the regulatory framework, because that's the key question. Can we improve the regulatory framework? Obviously, by definition, the reply is yes, we can always improve. The question is, in which elements can we improve? For instance, by modifying some legal provisions, by simplifying some directives, by modifying somehow the architecture of the existing legislative framework. Other aspect is the practical implementation. How can we improve the practical implementation at national level? In the basis of the existing experience, the national enforcement systems, how can they be improved? Not only the legislation, but other aspects are being considered as well. For instance, possible other accompanying measures to improve occupational safety and health. At the end of the day, this is the objective, as it was mentioned in the beginning of the conference. And finally, once again, how can we improve the coherence and the synergies with this policy area with other pieces of legislation? So, before finishing, I would like to emphasize a key element as well, is the large and very extensive involvement of stakeholders in this exercise. A lot of you are a good proof of this active commitment, which is essential to the success of the exercise. On one part is the advisory committee, the tripartite advisory committee set up a specific working party dealing with the evaluation. Since the beginning, they have been involved, since, let's say, even before the beginning, because they were part of the definition of the technical specifications before launching the tendering process. There is an internal inter-service steering group in the Commission with all the relevant services and DGs and units involved related to this evaluation. Of course, the EU agencies, the Bilbao agency and as well the Dublin Foundation are actively cooperating in this process, which is obviously very, very useful. And the SLIC is producing, the Senior Labour Inspectors Committee is producing as well a paper with putting forward their views on the evaluation. And it's important to mention that all the deliverables in all the steps of the process are being consulted with these bodies. So a very extensive involvement, and I would maybe specify about social partners, because the active involvement of social partners is as well a crucial element. On top of this involvement, through the existing structures, specific meetings of the social dialogue committees have requested to be informed, and of course the Commission, we have extensively informed about the process of evaluation at each moment. The national implementation reports include the views of social partners at national level, and that's very significant in our view. And as a part of the development of the project, the external contractor has performed a lot of specific interviews with social partners, more than 20 at the level of the European social partners, and more than 200 interviews with the social partners at national level. So that shows a very great involvement, an active involvement of the social partners. Coming already to the present and to the future of this process, maybe first to recapitulate where are we now. It was an interim report, the third one received last year, at the end of last year. It was a very interesting validation seminar in which some of you participated in December, the 8th of December in Brussels. We have already now, more than 1 month ago, at the beginning of March, the Commission has received the final report by the contractor. Now we are preparing, with the cooperation of all the bodies I explained before, the input to the draft final report in view of receiving the final, let's say, report by the contractor, which is due by June 2015. Let me maybe stress that the final report contains not only the report with evaluation, but 24 directive reports, specific reports on directive, and 27 country summary reports. So a lot of materials being analyzed and being assessed as well internally in this process. It is foreseen to adopt an extraordinary meeting of the advisory committee in September in order to produce the views or the opinion of the advisory committee on the basis of an ad hoc group which is working on that. And at the end of all this process, the Commission, of course, will produce the final evaluation for the Commission. I will conclude by mentioning that this extremely challenging and complex exercise is necessary. It's necessary and is an excellent opportunity to take stock of the reality about how the directives are being implemented in practice, and in a very practical way and look into the future as well. So excellent opportunity and collective task. This is a collective task, this evaluation, to address a collective challenge, the challenge of improving the regulatory framework, which at the end of the day is which is important. And is this preparation for the future? This evaluation is indeed a key element in preparing this immediate and medium-term future. As Teresa mentioned, the evaluation will be a key element in the future review of the strategic framework itself and in the review of the possible review of specific initiatives to be put forward by the Commission. Thank you very much for your attention.
Well, thank you very much, Jesús, for your presentation and also sharing with us progress we have achieved so far, but also our next steps for this OSH directive evaluation. Our next speaker of this session is Mr. Pascal Wolf, who is team leader at the European Commission for Education and Health Surveys. Mr. Wolf was a bit mysterious when he was asked what he is how he is dealing with the stress. He just said that he tries to have a good work and family balance in life, which is no doubt an important factor, but at the same time very difficult to be achieved. Mr. Wolf will introduce to us main results from a 2013 Labour Force Survey, ad hoc module on health and safety at work. Mr. Wolf, please, the floor is yours.
Thank you and good afternoon, everybody. As it was introduced, I come from Eurostat, which is a statistical office of the European Union, meaning that we are producing statistics on all fields of human and economic activity. And in particular, it means that maybe I'm the only one in this audience not to be an expert, I would say, on health and safety at work, because my main field of activity is education and health in general, not specifically OSH. Today, I would like to introduce to you the general framework and what we are doing at Eurostat in the European Statistical System about health and safety at work statistics, with a particular focus on the results which were released some months ago by Eurostat on the 2013 module of the Labour Force Survey. This is certainly something that is less known from you than the traditional accident at work statistics, and we see some added value to look at them more closely. Health and safety at work statistics at EU level, we have three main pillars. One, which is the accident at work statistics. They are collected from either governmental bodies or from insurance-based companies based on administrative data. They are accident-based, while we have a second source, which is the Labour Force Survey, which is an annual survey, and which conducts from time to time a specific module related to health and safety at work. LFS is a survey which is conducted among individuals. So we are asking people to tell us something about their health and the issues which could have happened in the context of their work, and also about their accidents. The final source of information is European Occupational Disease Statistics, also known as EUDS. This was mentioned in particular by Teresa Moitinho in her presentation. There is a willingness to improve this kind of statistics. At Eurostat, with the agreement of member states, we decided to stop the release of these statistics in 2009. I would say that even further, the general directors of national statistical institutes decided to give a kind of yellow card to EUDS. And all football fans know that yellow card doesn't mean a red card, but it really spotted the lack of quality, the lack of comparability across countries of this data. So we are trying to resume activities in this field, as Teresa mentioned, but there is a big effort to do at European level, but also at national level, in order to improve the comparability of this data. Our point is that it doesn't, and it was agreed by the working group on EUDS, that it doesn't really make sense to put together statistics which measure different entities, different subjects. So just some brief summary before, as an introduction to the labor force survey module, and in particular in comparison to accident at work statistics. The idea is how can you use LFS results to improve, to check, to compare with the accident at work statistics you can measure, you have already at your disposal. And of course this calls for a better coordination between labor inspectorates and National Statistical Institute, which are in charge of the labor force survey. As I said, the unit measured across LFS and ESAF are different, person versus accidents. The coverage, the LFS is not only about accident, but gives also some indication about health problems and exposure to different kinds of risks. When ESAF is, of course, focused only on accidents. Accidents in ESAF are superior to 3 days, from 4 days and more, while in ESAF, in LFS, we measure all kinds of accidents. But this is not an issue because we measure also the length of the duration, which allows to compare directly with ESAF data. In terms of coverage, we cover normally the same countries, I would say. Except that the 2013 module of LFS, we had a kind of difficulty in implementation. And because of the legal form that was given to this module and the lack of financial support that Eurostat could give to countries, Germany and Netherlands decided to run the survey, but not to disseminate the microdata to Eurostat. So we are trying to work with our German and Dutch colleagues in order to get some aggregated data from them. But for the time being, you will see that the results we can produce exclude Germany and Netherlands. Transmission is, of course, faster for LFS because it is a very heavy procedure and fast procedure. I tried also, for your understanding, to summarize what are the pros and the cons of the two sources. LFS, the advantage of using it, it links with all core variables. So you can have all detailed information which is available from the labor force survey about the characteristics of the individuals, about the characteristics of the working condition of this person. You have all accidents. It makes also some sense to look at accidents below 4 days, but also to road traffic accidents, for instance, which are not covered usually by ESAF data. We have also, of course, in principle, less under coverage than with, or reporting issues than with ESAF data. Disadvantages, because there are also disadvantages. LFS modules on health and safety at work are conducted on an irregular basis. There was a module in 2007, there was a module in 2013. Next module is foreseen for 2020. And afterwards, it should be every 8 years, given the pressure we have on modules. It contains only 11 variables, because it's a very heavy procedure, the labor force survey, and there is a legal obligation for the European statistical system to limit a topic every single year to 11 variables. So it means you have to select carefully which kind of information you want to collect from each individuals. It excludes fatal accident by definition, because we interview only person alive. And one methodological problem I will also mention in a couple of minutes is the recall problems. When you ask individuals, they don't necessarily always very well remember what happens over the last 12 months, and you could have an issue also related to that in comparing the statistics. As I said, the statistics are online, so you can surf on Eurostat website and you will find some information. More interesting maybe for those who are not familiar with the LFS module, which kind of topics we treated. In terms of accident at work, it's basically the number of accidents, including the road accidents, the job of accident, and the length of the period off because of the accident. And similar for work related health problems, the number of health problems, the type of work, the health problems, the job, and the length of the absence, and the exposure to physical health and mental well-being risk factors were under the exposure dimension of the module. So what are the issues maybe to have in mind when using the LFS data and comparing to ESAF data? First of all, we are talking about self-reported information, and sometimes in the labor force survey, we cannot address directly the person. It's somebody else responding for the person, what we call a proxy. The second difference is that we are referring to the last 12 months, when the ESAF statistics are based on a calendar year, so it could be some slight differences. We are reporting about the last accident in more detail, while ESAF compares all kinds of accidents which occurred over a year. Something much more important maybe, which is in European statistics, we are looking for output harmonization. It means we define with countries the kind of output we would like to get from each country, but we are not looking, we are not allowed to look at the way the countries collect the information. In particular, we recommend questions, but countries are not forced to follow Eurostat recommendations. So in practice, most countries follow rather closely what Eurostat recommends, but it's not necessarily the case. And we have to be careful in analyzing the results. That it could be some differences in the way the questions were implemented. And in particular, in 2013, we have an issue we have discussed with our French colleagues because we have some differences. So it could result from this some cross-country comparability issues, or even some issue of comparability over time when questions were changed in one country. It could be an issue. We have no microdata for Germany and the Netherlands, as well as Iceland, as I explained, but we are trying to get some aggregated data because both countries run the survey at the national level. Finally, to try to appeal you, I will give you some basic results from some of the variables. Of course, we could potentially deliver much more because we can link any variable to any. These are just to give some illustration of where we are with some of the main results of the module. For instance, and I will only highlight the striking countries which are really out of the average. In this case, this is the share of people reporting one accident or more by age group, and we see here that there are two countries, Switzerland and Finland, which are reporting very high level of share of person employed compared to the rest of the countries where we have a quite low prevalence. Second example is how many of these people declared a sick leave after their accident, and what was the length of this sick leave. And this is an added value of the module, for instance, compared to ESAF. And here we see that we have a number of countries where the percentage of long duration, 1 month or beyond, exceed 30%. This is the Czech Republic, Italy, and Poland, where we see really a big number. Of course, this information needs to be detailed with additional information on the type of occupation or the sector of the employee. But here we see certainly an issue. Road traffic accident is usually not covered by ESAF, so it's quite interesting to see how many people are concerned by a road traffic accident commuting to their work. And here we have three striking countries which are largely beyond the EU average. These are Poland, Turkey, and Croatia, which have a ratio of people declaring a road accident over 20%. Among those declaring an accident. Finally, something that is possible is to look at sectors, and here we looked at the agricultural sector horizontally, and vertically the industrial sector, where are the accidents, and we see that there is an excellent correlation between the two, and there is no one country which is, if I can say so, more specialized in some type of sectors, and another with another type of sector, and we see this distribution which is quite common between the two big sectors. And these are, of course, the main sectors where we observe accidents. And again, we see the striking position of Finland and Switzerland. Now, going away from the accident at work domain, we have questions about health-related problems and occurrence of these problems. You see that most of the countries, there is a relatively low percentage of people declaring work-related problems, below 15%. But we have some countries which are largely beyond, with in particular Finland and Sweden. If we go into the type of health-related problem, I was interested to read from Teresa that there is a particular interest to dig more into the musculoskeletal disorders, because this is clearly what was revealed by the LFS module as the most important health problems, and up to 70% of the people declaring health problem in some countries. And we have then the stress, depression, and anxiety problems, which are really important, with a very high proportion in the United Kingdom. Coming to the risk factors, we had a question about harassment or bullying, and here we see, of course, a relatively low prevalence. But with two exceptional countries, which are Cyprus and Luxembourg. And we will see again the case of Luxembourg later on. So this is, of course, it will be interesting to go a bit further. This is total figures, but I couldn't give so many details here. Of course, we would again need to look at kind of sector or occupational which are behind this high overall and average figures. Exposure to violence or threats of violence. Here, again, we have quite striking distribution, with a number of countries below 1% of people declaring. I draw your attention that there could be also a cultural dimension in this type of questions, because, of course, in some cultures it may be less easy to report about these issues. And we see Portugal and Finland as at the extreme right, declaring more often this exposure to violence or threats of violence, with about 5% of cases in average. Final graph, it's about time pressure and overload of work. And you see here we compared the 2007 and 2013 data. We have similar variables. We see in general an increase between the 2 years. In some countries you can see an increase by 5 to 10% or more between the two last surveys. And we see a number of countries which have very high proportion of overload, but again, this would need to be looked at in more details. So on the extreme right, you have countries like Switzerland, Austria, Sweden, and Luxembourg, again, as the leader. Thank you for your attention.
Well, thank you, Mr. Wolf, for very interesting data you shared with us. And I wonder if some of the audience or maybe the panelists will be using part of those data when asking some questions. Now, as our last speaker of this session, I'd like to introduce Mr. William Cockburn from European Agency for Safety and Health at Work. As acting head of Prevention and Research Unit in the agency, William stands the closest to the results of ESNER survey and has a first-hand information on new and emerging risks. As work-related stress is one of such emerging risks, we of course naturally asked also William how he is dealing with stress and how he is coping with it. And what politically correct and I must say employer-loyal answer he gave us: just follow EU OSH Agency E guide on stress. Well, and if that doesn't help William, he takes his bicycle straight up a steep hill. Unfortunately, William, we haven't prepared for you a steep hill here, but we have this podium, so please, you are very welcome to share with us your presentation.
Thank you, Renas. Thank you for the kind invitation and introduction, and thank you to the EU Presidency also for this opportunity to present the fruits of 3 very intense years of work at the agency. I'd like to recognize that for firstly my colleague here, Sabi Rastorza, who's the project manager in charge, but also in this room there are many who contributed to ESNA as focal points, checking questionnaires, and I know that that was really quite demanding work at times. Just to give you an idea of what my presentation will cover, I think it's necessary to give a very short introduction to the methodology behind the survey, not only so that you understand maybe in comparison to the sort of data that Pascal was presenting where this comes from, but also so that you can situate it in comparison to the first ESNA that we carried out in 2009. This second survey ESNA basically covers the same structure as ESNA 1. We looked at how health and safety is managed in practice at the workplace day to day. We looked at how psychosocial risks are managed in the workplace and contrasted the two. Then we focused on what are the main drivers, what motivates people to take action on health and safety, and what are the most important obstacles. And finally, we looked at worker involvement, how a worker is involved in day-to-day management. So you'll see from that content that it's very relevant for the European acquis, for the legislation that it's in place, and the results of the survey are hopefully very relevant also for the ex-post evaluation that's been going on. And the timing has been very fortunate. We've been able to make the data available to those running the ex-post evaluation project. And the timing is also very opportune because it is in harmony with the labour force survey ad hoc module. So that gives us some opportunities for joint analysis of the 2 data sets. Just to give you some key dates, we actually started fieldwork around June and finished in October last year, and we produced the first data which we were able to supply to the Commission's contractors in November. Already in February, we published on our website a very short summary of the first findings from the results. Today you have the summary of the first summary of the ESNA survey results, which are available in English and Latvian for this event, and we're in the process of translating them into all languages. For us, our next big outing will be at the European Parliament, yet to be confirmed, but likely to be at the end of June, and there we'll present again the results, specifically focusing on our visualization tool that allows you to access the data. We're also making the data freely available for researchers through a data archive, and all the technical reports are available on the website. I should take this opportunity to mention that this data, I'll present now some very first, if I can say simple analysis, but they allow the amount of data that we've collected, allow much more sophisticated analysis, and we've already launched 2 secondary analysis projects, one looking at worker participation in the management of health and safety that's based on face-to-face interviews in a number of enterprises that participated in this survey. And then we also have a project where we're going to take advantage of that coincidence in time that I mentioned with the LFS ad hoc module and see how we can combine the data from the two surveys to provide a more complete picture, as we'll have information from the worker side and also information from the workplace. The main changes then, and some of the main characteristics of SNA 2, we increased the coverage in terms of countries, so we're covering 36 countries this time, all of the EU, 28, the countries we covered last time, Turkey, Norway, Switzerland, but also this time we included Albania, Iceland, Macedonia, Montenegro and Serbia. We increased the sample size in each country compared to the first survey by about 50%, and obviously we included these new countries. So we're talking about nearly 50,000 interviews that we carried out for SNA 2. We developed 47 versions of the national questionnaires, which were not only adapted for language, but also for the legislation and the structures in place in each member state. And most importantly, I think, is how the universe changed, the target group for the survey, the coverage. In the first survey, we surveyed establishments with only 10 employees or more. And there was a strong demand from stakeholders that we should focus on micro-enterprises. And although it's quite challenging, we expanded the universe for this second survey to include those workplaces employing as few as five workers. We also broadened the sector coverage, particularly important in some member states, so that it includes agriculture and fishing. We also changed the respondent, but I'll mention that in a moment. So as I said, the fieldwork ran from the summer until October time. You can see here that our main focus in the sample was on micro and SMEs. 42% of those that we interviewed were in the size class 10 to 49 employees. It's a sample that was designed to ensure quality and comparison between countries covered. What it means in terms of numbers and representativity is that we are able to speak, if you like, on behalf of 6.7 million establishments in Europe. That's the equivalent of those covered in our sample out of the 21.5 million enterprises that there are in Europe. The ones that we aren't covering are those that are employing below 5. And our survey then covers 183 million employees out of the 217 million workers in Europe. That means that on average, each of our completed surveys represents 135 enterprises in Europe. But that varies a lot between member states. So in Germany, although we were able to carry out 2,500 interviews because of the size of the economy, the number of enterprises, that's one survey for each 506 enterprises, whereas we go to Iceland and it's one for every 8. Or Latvia, one for every 33, even though we had a smaller sample size there of 750. I mentioned we changed the respondent, so who we ask in our interview to answer our questions about the management of health and safety. In the first SNA round, we asked firstly a representative of management, and we said very clearly we would like to speak to a representative of management who's responsible for managing day-to-day issues around health and safety, and then where possible we did a survey with a worker representative. We found that that was leaving out of our sample quite a lot of enterprises, particularly those who said we don't have somebody in the management who is able to answer on this issue. So we changed the respondent to the person in the enterprise who knows most about health and safety. And that throws up some interesting breakdowns regarding who is this person who knows best about health and safety in the establishment. As we might expect, on the left side here, for the smallest size class 5 to 9, we can see that it's the owner-manager who's most likely to be answering on this question. But there's also quite a few who include a manager. Those proportions go down as the enterprise size increases. So moving across to the right there, the large size enterprises employing 250 or more, they're not likely to be directing you to the manager. They're much more likely to be directing you to an OSH specialist, much more likely to be there. What's curious is that across all size classes, quite consistently, you see about 20% of cases referring you to the worker representative on health and safety as the person who knows most about managing health and safety. Although what's maybe more interesting is how those differences are seen across countries. We asked, as one of the first questions then, what are the risk factors that are present in your workplace? And we asked whether they are controlled or whether they're not controlled, whether they affect a lot of people or a few people. And we can see here the influence of the service sector jobs in the European economy, accounting for the fact that the most commonly cited risk is having to deal with difficult customers, patients and pupils. Those psychosocial risk type factors are the ones indicated in orange. The next orange one down there about halfway through the table is time pressure. Just below that first one are ones relating to MSDs, so tiring or painful positions, including sitting for long periods, repetitive hand or arm movements, risk of accidents with machines or hand tools, and so on. I won't read through the whole list. Digging a little bit more deeply into the results of the survey, I think what's interesting here is to mention that we have these risk factors relating to psychosocial risks in first place, and again a little bit below. We asked another question as a follow-up question to the presence of these risks, whether you have sufficient information or tools to manage them. And 1 in 5 establishments said that this is not the case, that they lack adequate tools or management for management of these psychosocial risks. And this backs up some of the earlier research which indicated that management of psychosocial risks is indeed more difficult than more traditional risks. It's interesting to see those results broken down by sector, and we can see that in agriculture, forestry, fishing, construction, manufacturing, it's a risk of accidents with machines or hand tools that are the most common risk factors identified. Lifting or moving of heavy loads, repetitive hand or arm movements, whereas we move into more service sector type activities, finance, real estate, public administration, it's tiring or painful positions, including sitting for long periods and having to deal with difficult customers, patients or pupils, which are in all cases the highest cited risk factors. It's worthwhile mentioning here that in fact MSD type factors, so prolonged sitting or repetitive movements, were mentioned very high up in all of the sectors. They're common across all of the sectors as a high prevalence risk, and you can see the other risks there are maybe more driven by the exact sector type. Looking at the extent to which risk assessment is carried out regularly in workplaces across Europe, we see the average for Europe is 76% of enterprises saying that they do so, with quite significant variations between member states. That matches quite closely the results we found in the first survey, actually a little bit lower because we were more precise about the way we formulated our question. We excluded checks similar to risk assessment. We just specifically said workplace risk assessment carried out regularly. These differences between countries, we can see Italy up here, nearly 95%, Luxembourg down at about 37%. They're driven to a very large extent by sector and size class. So larger establishments are more likely to carry out a risk assessment. Those working in manufacturing, agriculture, forestry and fishing, or in construction waste management are more likely to carry out risk assessment. So countries that have predominantly small-sized establishments working in the service sector are likely to have a lower percentage of establishments saying that they carry out risk assessment. The other point to mention from this slide as well is that the orange bar represents those risk assessments that were mainly carried out using internal staff, which is in essence is really what the framework directive, the systems-based approach, the goal-setting approach aims for. It aims for the person who's in charge of the risks, who most controls the work processes, to be the one who is free to design the preventive services, and there's that flexibility built in to respond to different types of risks. And at least the premise is that the first simple global risk assessment should be able to be carried out in-house. Then when you identify something that's more specific, more requiring expertise, then that is a moment to go for an external expert. And we can see there that in countries like Denmark, UK, Sweden, the vast majority of risk assessments are carried out in-house. But you can contrast that with Slovenia or in Spain, where we know that there's a large industry built up in the preventive services, where quite a high proportion of enterprises immediately go to for their risk assessment and preventive action. So moving on to the drivers, and why do enterprises carry out risk assessment? Why do they not carry out risk assessment? And I have to emphasize that this question was only asked to those who said that they did not carry out a risk assessment. The main reasons given are that the hazards are already known, or that there are no major problems. We also asked, or gave as options for reasons, that the necessary expertise is lacking, or that the procedure is too burdensome. And you can see that particularly in the smallest size classes, those reasons are the lowest, with a big difference to the fact that they think that there's nothing to do, or that they have no major problems. For us, I mean, that emphasizes the need to raise awareness, to explain the use of risk assessment. In the previous survey, we saw that the vast majority, 76% of establishments, do carry out risk assessment. We asked them actually whether they found that a useful approach to managing health and safety, and 90% of them said that it was useful, that they did find it a useful exercise. So somehow we have to reach out to this small subset, relatively small subset, that are not carrying out risk assessments, and raise their awareness about the need to do so, and how it is a useful procedure. One of the elements that we know for successful health and safety management is commitment from the top-level management, and we heard it earlier in one of the examples from the Good Practice Award winners. So to try and get an indicator in that direction, we asked about whether health and safety issues are discussed at the top level of management. Now, we only ask that in workplaces employing 20 or more. It makes no sense really to ask it in smaller enterprises. But again, we can see quite significant differences between member states. Highest levels in Czech Republic and the UK, lowest levels in Estonia and Montenegro. And for us, this is one of the indicators that can be used when we're looking at, say, identifying the level of safety culture that might be, or preventive culture that might be being fostered in the different member states. So looking at drivers then, what are the major reasons for addressing health and safety now? 85% say that it's fulfilling the legal obligation. Just below that, just below 80% are saying that it's to meet the expectations from their employees or their employees' representatives. At about the same level, we have avoiding fines from the Labour Inspectorate, then slightly lower, maintaining the organisation's reputation, and finally, maintaining or increasing productivity. Again, we've got some country differences. So those member states joining the EU in 2004 and the candidate countries together, they tended to mention maintaining the organisation's reputation as the most important driver for addressing health and safety. So again, we can see some interesting differences between countries. It's worthwhile pointing out also that the fulfilment of the legal obligation becomes more important as the enterprise becomes larger, and maybe that's linked to the probability of having an inspectorate visit to check up on their conditions regarding health and safety. We asked also about the major difficulties, and this is to all of the respondents. What are the major difficulties in addressing health and safety? And we can see here by size class that common to all size classes, it's the complexity of the legal obligations and at some distance below, the paperwork that are mentioned. Then we have a lack of time or staff, a lack of money, a lack of awareness among staff, a lack of expertise or specialist support, and finally a lack of awareness amongst management. What's important behind this statistic is that we found important differences between countries. So if we take the first of those barriers, the complexity of the legal obligations, in one country that was cited by 67% of the workplaces, and yet in another one it was just 9%. So what is showing, I mean, all of these companies, all of these workplaces are all subject to the same European directives. what we're seeing is that it's the transposition of those directives that is then being translated into the experience that is borne by the workplaces. We can highlight the Nordic countries, Denmark, Finland, Norway, Sweden, where they're saying it's the lack of time or staff that's the major difficulty when dealing with health and safety. And a lack of money instead is most frequently reported as a major difficulty in Lithuania, Latvia, Montenegro, and so on. I think it's an important result because it's very relevant for the evaluation, and because it also highlights the potential that there is there to improve the context in which workplaces operate, either to improve the national level legislation, or to improve the guidance, or improve the way it's communicated, or improve preventive services. But we can see with the same common EU acquis, we're seeing very different situations across Europe. I mentioned at the beginning that we also contrasted the management of general health and safety risks with those of managing psychosocial risks. And here I can highlight the barriers or the difficulties in addressing psychosocial risks. And common to all size classes, we can see that it's the sensitivity of the issue, a reluctance to talk openly about these issues, and to a lesser extent, a lack of awareness among staff. It was interesting to have the comment that we need more examples for micro enterprises, and the discussion that ensued this morning, because we can see that, at least from the workplace perspective, the smaller the workplace, the less of a problem they see in tackling psychosocial risks. It becomes more of a problem with the larger sized establishments. This maybe is an area where we think that a workplace might need to employ a specialist when they identify a problem. And we asked in this case about the use of a psychologist. We asked about a number of expert services that would be used in the management of health and safety. The most common were occupational health doctors in 68% of establishments, generalists 63%, accident prevention experts 52%. But here we can see the use of psychologist is around 17%, but with enormous differences between the member states. So again, potential to learn from different countries' experiences in the application of expert services and use of specialists in particular. And I'll just show you then again, given the importance of MSDs that I mentioned at the beginning, I'm out of time, but there's only one slide left. The importance of MSDs that we saw from the LFS and also from the earlier slides I mentioned, and this is the use of the ergonomist. The final topic we touched on was the different forms of employee representation. Just to highlight here, as you would expect, the health and safety representative is the most common of the representative structures, and the variation is quite strong between sectors, highest in public administration. You should receive today, or you should have access to, the summary that we've published. We're also organising seminars with national focal points to disseminate the results. We have a visualization tool that will be going live in June, as I mentioned earlier. And it's really just a 20-second clip here to show you how it works. I think that's the end of the film. Okay, you can select a question of the different questions that were asked within ESSENA there, you can see. You can see the results on the country map. So you've got the results there for Latvia. You're able to select countries for comparison of the national results with those of another country, or here you can see comparison against the EU 28. You can break down the results by specific sector, and you can export the graphic for visualization if you want to share it in social media or include it in a presentation. Just finally, you can see the national breakdown by size or sector, and then at the end it just mentions the sharing by social media. Okay, that's the clip. Well, there was a thank you slide, but thank you. Thank you for your attention.
Well, thank you very much indeed, William, for this very interesting information, I think also for new facts. I also hope that your presentation will help as inspiration for those panel discussions we'll have just after the coffee break. The panel discussion will be moderated by professional journalist Harald Burkowskis, who is already here. Maybe you could stand up so every panelist knows that if they have some questions, they could approach Harald and ask those questions before discussion starts. It is really now time for a coffee break, and you must use your time wisely, as we didn't have a special opportunity to ask questions to our panelists. So you can do that during the coffee break. And you can also still use your time to play those interactive tools we have outside of this room. Since we are a bit late in the program, I still would like to give you a proper time for coffee, so we are expecting you back here in the conference room at 4 p.m. And so enjoy your coffee, and while you do your applause round to our panelists, I'll also have some small presents for them. Thank you.